Well, good morning, 8:18, and here it is, our web poll question of the day. Will you purchase marijuana now that it's legal? We've been asking you that this morning, and so far, 19% of you say yes, 81% of you say no. You can have your say by heading to our website at ctdottawamorning.ca. Canada's prohibition on marijuana is officially over. As of midnight, you can legally possess, use, and grow recreational marijuana in Canada. But with the new rules comes a lot of questions about health and your job. We're joined this morning by Dr. Paul Roumeliotis, Medical Officer of Health for Eastern Ontario, Alex Lucifero, Managing Associate of Samfiru Tumarkin LLP, and Marino Francispillai with Ottawa Public Health. Gentlemen, good morning. Thanks for being here.
Good morning.
There's a lot of questions. We're going to try and get to as many as we can this time, and they're sticking around for the show. So if you have questions, send them in. Dr. Paul, let's start with you. This is a tough one, I think, for parents, because parents have to now look at maybe what might be their own habits and what they do or don't do around their children. Let's start off with, should parents be consuming marijuana around children?
I think they should not. There are a variety of reasons for that. Number one, you're actually role modeling what you're doing. We don't want children to either smell it or be enticed by it. And studies have shown that the more they're exposed to it at a young age, the higher the rates that they will use later on in life. So I think it's quite important for parents and caregivers and babysitters and so on to do it discreetly. It's not a top secret. You know, you can discuss it, and we'll get into that later. But in terms of smoking around children, modeling, leaving your marijuana around, leaving it around, edibles and so on, we've had negative experiences in the United States in terms of medical implications, kids getting into it, eating it, and getting into hospitals and so on. So basically, you should not be storing it around them, it shouldn't be accessible to them, and they shouldn't be seeing you as much as possible ingesting it or smoking it.
We know the legal age in Ontario is 19.
Yes.
How dangerous could it be if it gets into a child's system?
Well, I think the dangers are in chronic exposure, obviously, but in the younger kids, a lot of it can cause an overdose symptom, for example, a high heart rate and so on, requiring hospitalization, which is what happened in Colorado and Washington State.
Yeah.
But the other thing, too, is if a child chronically is exposed to it, that's the reason we don't want young children and young adults to take it unnecessarily. It can cause brain damage and brain dysfunction in the long run.
Yeah.
So it's not immediate. So the later you use it, the better it is. And if you're going to use it, go low, go slow.
Okay, I'm going to skip over then to you, Marino, because along those lines, I want to ask you, as far as parents, then do we hide it from our kids if we want to consume it, or do we tell them that we're using this? They see us drinking a glass of wine at the end of the day. Is it okay to consume marijuana in front of them?
It's a great question, Annette, and it's a tough one. It's a tough one that parents are struggling with. We started our parent info sessions, and parents are asking this question. You know, it's the balance. You want to be authentic with your kids. You're having conversations with your kids. We're saying you need to talk to them often, talk to them early. But the reality is that at the same time, we know that there is role modeling involved. We know that what kids see their parents do, they'll often look at and consider doing themselves. So as much as possible, you know, our recommendation is not to do it in front of your kids. But at the same time, you know, you're going to have a tough conversation to deal with.
And how do you talk to them about the fact that it's legal now? Because just because it's legal, as I'm hearing from health experts, it's not safe, right, Dr. Paul? So is that the core message you need to get to your kids?
Definitely. I mean, I think depending on what age you're talking about, we always talk about talking to your kids early on this stuff, but as they get older and they're in their teens, you know, there's really 4 levels of this message. It's, if they're not using now, don't start. If you're gonna start, try to delay till you're 25, because we know that it impacts brain development, it has mental health impacts, and it increases your risk of addictions. And then we already know that people are using already, and there are teens using in Ottawa. You know, we know that we're 18% in Ottawa that are using already. So how do we help those teens reduce their risk? Well, we've got a lot of tips that we can use. You know, Dr. Paul was talking about start low, go slow, right? So there's things like that we have that we recommend. Try not to smoke it. There's a lot of options, and definitely don't use and drive.
Okay. That takes us to a little bit down the lines of the legal elements. Let's talk to you about that, Alex, and let's talk about the workplace element too. So can you go to work today and smoke marijuana?
So we're dealing with some tough issues here. I mean, obviously talking to your children is a tough one when it comes to marijuana. The health implications is another. The laws when it comes to the workplace are a little more straightforward. The short answer to your question, Annette, is no. You cannot smoke or consume or vape marijuana at work. The law is crystal clear about that. Where employers need to step in at that point is making a workplace policy, creating a policy and implementing a policy that says that you cannot show up to work impaired.
Okay.
That's a different thing. You could consume marijuana at home but attend work impaired. If you work in a safety sensitive position, that's a huge problem, of course, and that could get you in deep trouble as an employee. And so employers have an obligation there to make sure that their workplace is safe and a healthy work environment. And so they have to be careful to ensure that employees know exactly what they can expect in the workplace.
What then happens if someone does show up impaired? They did not consume the marijuana in the workplace, but they show up impaired. Can the boss send them home? Can they be fired? What happens at that point? What do they have? Do you have any rights, or do they have any rights?
You can as an employer, and again, the starting point here is that you have an obligation as a boss, as an employer, to maintain a healthy and safe work environment.
Okay.
And so, if you have reasonable grounds to suspect that an employee is intoxicated, and listen, we're talking about marijuana today. We could be talking about alcohol. We could be talking about prescription medication. And so, in the event that happens, as an employer, sit that employee down, send them home. There might be repercussions for an employee in a situation like that. You might be disciplined, you might be suspended, you might be terminated. And there are protections as well for an employee in that situation. You cannot be wrongfully accused of being impaired, maybe perhaps because you simply smell of marijuana, for example. And so this is a balance of rights and obligations on both sides, on the side of the employee and the side of the employers.
Really new territory we're entering today. Do you think we've come far enough along, Dr. Paul, with education about marijuana and what it is exactly, what you're putting in your body if you consume it? And we're talking about something that some people may have tried years ago in their younger years, and has it changed? What do we need to know?
That's a good question. First of all, if you look at Canadian statistics, by the way, Canadians are among the highest users, even when it was illegal, right? So in the world, about 40% have said they've used it in their lifetime. But having to do with marijuana expectations, and people say, yeah, I took it when I was a teenager in the 60s. First of all, marijuana has changed. Okay, the THC and we know. So a marijuana plant is a plant that has chemicals, and the chemicals, THC is one of them, is the one that makes you high, for example.
Sure.
CBD, cannabinoids, and a whole slew of others that have some pain relief and so on. But the THC concentration is the one that we worry about the most. And THC concentrations have quadrupled between the 60s and now. So people need to be aware of that. So yes, we still need to educate people if they're going to, again, part of the low risk guidelines that we talk about, if you're going to be using it, make sure that you use low THC concentrations and high CBD concentrations. It tends to be, the CBD tends to equalize the effect of THC.
Right.
However, people are not very aware of these things, and a lot of misconceptions about medical use and non-medical use. And so we don't call it recreational, we call it non-medicinal use, non-medical use of marijuana. That's the distinction, because we don't think that automatically, just because one wants to have fun and recreation, that you should take marijuana.
Right.
So the term recreational marijuana to me is a bit of a misnomer. But again, people need to be aware that these substances do have side effects, and education campaigns we've started, Ottawa Public Health has started, Marino and all of us have gotten together, have got policies, questions, FAQs, school and education, and we can't give them enough. We need to continue it and continue the education, because we need to ensure that it doesn't become normal part of society.
Okay.
Just like cigarettes are denormalized, we can't normalize these, and we'll talk about e-cigarettes another time as well.
Okay.
That's another
I could actually make a point on the issue of medical marijuana. It's a great point that you make, Paul. When it comes to workplace rights and law, we do have to make a distinction between medical marijuana and recreational marijuana, or non-medicinal marijuana, if that's the way we're going to call it.
Sure.
An employee does have the right to use medical marijuana in the workplace, provided that impairment is not an issue, and provided that employee is not in a safety-sensitive position. So there is a caveat and a kind of cutout here for medicinal marijuana users, and I would encourage those individual employees to perhaps obtain some legal advice.
We have to take a little break. I know this conversation is going to continue. There's so much more to talk about. We've just got it started. Dr. Paul Roumeliotis, he's the Medical Officer of Health for Eastern Ontario. Alex Lucifero is from Samfiru Tumarkin, Associate Lawyer. And and we have Marino Francispillai from Ottawa Public Health. They are going to stick around. The gentlemen are going to be here for the rest of the show. So if you have questions for them, let us know. We are going to take those questions. We have some coming in already, and we will answer them in the next hour and a half of the show. And we want to remind you, CTV News is presenting a very special broadcast today. Now that cannabis is legal in our country, CTV Ottawa will broadcast live from the Tweed facility in Smiths Falls and have guests answer a range of questions starting at 5 tonight. And we want to hear those questions for you. As we mentioned there, we have our experts here. You can send them to us, ottawanews@ctv.ca, or through our social media channels. We'll be answering those questions until 10 o'clock this morning and again this evening. Stay with us. We're back after this.